come to you first, since you are associated with a sector that we deal with almost on an everyday basis, right? Healthcare. So healthcare has evolved, is evolving, it has to evolve given that incomes are rising, given that we now have an aging population, and also given the fact that there is a certain degree of focus on chronic diseases. I want to ask you realistically, what is the healthcare sector expecting from this budget? And I'm going to underline realistically here.
So thank you so much. As what I had mentioned yesterday in my pre-budget pointers is that this will be one of the best budgets that India have ever seen in healthcare. As the Union Budget 2026-27 approaches, the Indian healthcare and pharmaceutical sectors are advocating for a shift from volume to value. ये आपको देखने में मिलेगा, from volume to value. And the industry's primary demand is to increase public healthcare spending to 2.5% of GDP. आपको याद रखना पड़ेगा, we are currently at roughly around 1.9%. And this is what will actually build a future-ready healthcare. Now, जो मुझे दिख रहा है, what I understand is that there will be a lot of focus on R&Ds, which will definitely be there, and the industry is a strong advocating for the restoration of the 200% weighted tax reductions on R&D expenditures. You will see a lot of PLI 2.0 coming up. So while the first production line incentive schemes, आपको याद होगा, focused on active pharmaceutical ingredients, the sector expects a PLI 2.0 on expansion that covers the medical devices and diagnostic equipments. Now for pharma, retail and OTC, definitely regulation clarity would need to be there. Retailers are looking for clearer guidelines on over-the-counter, the OTC drugs that we say, to expand their market. They're projected to reach roughly around 98,000 crores by 2030. So there will be lots and lots that we would expect from healthcare. You will have a lot of focus definitely on the villages that would come through. AI and digital health would be a very strong focus this time, because our Honorable Prime Minister always spoke about that. And I think AI and digital health will get a complete different movement, where you will see Ayushman Bharat digital mission coming up very, very strongly. And that have to be a strong push that would happen. See, if you really see overall, I have told yesterday, this will be one of the best budgets in healthcare that I expect to come.
Okay. Can I just get in Manish here? Manish, there is a lot of talk about AI in healthcare. Can I ask, and there is, we believe, going to be a lot of focus on AI, but what exactly? There are people who are watching here saying AI तो सब बोल रहे हैं, लेकिन budget AI के लिए क्या करेगा? And how does that benefit the middle class in this country?
Firstly, very good morning. Now, in terms of the budget that I'm expecting, right? I mean, from an AI sector perspective, there has been a lot of progress the government has made in the last couple of years. The India AI mission is obviously the flagship program of the government, which it is allocated close to 10,000 crores over the next 5 years allocation, right? So, but what we see is in this day and age, and that we see it regularly, is AI is actually being implemented by a lot of these enterprises on a daily basis, right? On a regular basis as well. And it's not just the enterprises, it's even the government. The governments are also adopting AI in a lot of citizen-facing initiatives, be it healthcare, agriculture, or even your day-to-day activities as well, right? So we see a lot of adoption happening in AI on a regular basis. Now, what we expect from a budget perspective, obviously, is for AI to really flourish. GPUs are the most important commodity for startups like us, right? If we have to make any kind of innovations, obviously GPUs are the bottlenecks that we typically see in this industry. So what we are expecting is a lot of doubling down of the government on GPUs, particularly allocating them to startups, which will further fuel innovation as we move along, right?
But so Manish, there are a lot of people who are hearing you talk and saying, but AI is going to take away our jobs.
Right. Now, that will happen, right? To some extent, not every job. There will be a lot of new jobs which will be created as well. But yes, the lower service class jobs, which probably will get eliminated with AI to some extent, right? And there should be a policy initiative to actually reskill.
That is going to be the challenge, I think, Manish. The government is telling us that we are in a Goldilocks moment. The chief